you're
Good
unmuted.
afternoon, everyone. If I could ask any visitors or visiting Rotarians or guests to please unmute themselves and introduce themselves, or have their host member introduce themselves, that would be great.
Hello, this is Deborah Boynton. I'm here as a guest today.
Hi, Deborah. How are you?
I'm good, thank you.
Hello, this is Patrick Phillips with Lakeland Regional Health, here with Dr. Haight to speak to you all today.
Do we have any other guests or visiting Rotarians?
Well, this is Brock Self. Deborah is my guest, and I guess I'm just waiting for a point to jump in there, and she beat me to it. So welcome, Deborah.
This is David.
And do we have anyone else? Okay, I guess that's it.
All right. Thank you, Trey. Welcome, everyone. Thank you all for joining us today. We appreciate having you all here. We're going to move on to Happy Dollars. If there's anybody that would like to make an announcement regarding Happy Dollars, this is your chance.
Oh, I went last week, and I'm not, always brave to stand up and share, but we're celebrating 14 years of marriage, my husband and I, Ray, tomorrow. And so we're excited for that, and I'm happy about it.
Congratulations, Gwen.
Congratulations.
Thanks.
Anybody else?
I'm going to do a happy dollar since I wasn't quick enough on the draw to introduce my husband. He's going to be joining us today. He's with Public Specialty Pharmacy, so he wanted to hear all the information on what's going out in the medical world. So my husband, Nathan, is going to be joining us also.
That still costs you $1.
I'll pay it.
It should. She forgot me.
This is Roxanne, and I have a happy dollar to say that there are only 10 Rotarians left who haven't picked up their shirts. So please do so at your earliest convenience from 8 to 6, Monday through Thursday at 3020 Lakeland Highlands Road. Thank you.
That is the facility known as the Central Florida Speech and Hearing Center, correct? Okay, thank you, Roxanne. Yeah, get by and get your shirts if you haven't already, please. Anybody else? Okay, fantastic. Let's move into announcements. I've got 2 announcements I want to go through. Most of you know this already, but the Mutz family, Mark and Savannah Mutz, they live in Colorado. They had a son that was born at 1.5 pounds. Obviously, the child was born early. No name yet, but they received a positive news on Facebook this morning. The mayor posted a positive statement that things are going as well as they can and should be going right now. So they asked for everybody to lift the family up in prayers and just think about them early and often, please. On another note, we have 62 Rotarians that have not paid dues. So in order to remain as a member in good standing, you really need to pay your dues, and you really need to have them paid before August 1st. So if you're loitering, if you're just forgetting or something, please take the opportunity to do that as soon as you possibly can, because we have bills to pay. We got obligations to meet, and 62 is a lot of people. So please don't be outstanding in your field in that category. Anybody else like to make an announcement? Crickets? Very good. We're going to be able to get right into our program. Then we've got a fantastic program. We're so happy to have our speakers here today. Our own Don Selvage is going to introduce the program and get started for us. So, Don.
Thank you, President Joel. It is my pleasure to introduce 2 distinguished guests from Lakeland Regional Hospital today to talk to us about a very important subject. Dr. Daniel Haight, a longtime friend of mine, is a professor of infectious diseases at the Morsani College of Medicine at USF. and he's also the Vice President of Community Health at Lakeland Regional Health, where he also serves as the Medical Director of Infection Prevention and the Hemodialysis Unit. Prior to joining the LRH in 2012, Dan was the Director of the Florida Department of Health in Polk County for 16 years. With him today is Patrick Phillips, who is Lakeland Regional Health Senior Vice President of Business Development and Chief Strategy Officer. He most recently served as the Senior Vice President and Chief Operating Officer at Wayne UNC Healthcare. So please join me in a warm Rotary welcome to our two distinguished guests.
Hear me okay?
Okay, yeah.
Very good. A couple of mute buttons to press there. You know, we're just going to cover an overview of what's happening in our community with a little bit from our perspective as the medical center and some issues with COVID-19 and the SARS virus that causes it, along with what we can do to prevent this disease and also, you know, to make things continue to function properly. How are we engaging with the community and what's our outreach to the business to make things get through this together? So I'm going to cover the first section. Generally, you know, many of you are well aware of our 100-year history. In fact, it brings back the 1917 flu pandemic that occurred that we were as an institution back then here, and we've grown to about 864 beds. One should make sure you see these numbers so that you know the capacity that we have relative to the current issues we're dealing with. Certainly, we're the fifth largest hospital in Florida. We're also the second largest and second busiest emergency department in the entire United States. And did actually receive some good news today that we'll be getting more out there, is that U.S. News and World Report has ranked us the #1 hospital in Polk County, but our state ranking has gone from 21 and improved to 15 in the entire state of Florida. We have about 600 physicians on staff, and we're here in the community for you. And next slide. So we have an incident command system that's set up during urgent situations. We use this incident command if there's a hurricane coming, but we've really had to step up the incident command ever since this pandemic was realized a number of months ago. In our incident command, we have dashboards that give us the up-to-date situation. This is a screenshot of our dashboard taken probably just a few minutes ago. Let you know that we have 149 patients in the hospital with COVID-19 diagnosis. We have some tests that are pending, and about 28 of them. We have 15 people on a ventilator at the moment, and overall our use of ventilators is 40. But you know, the key issue is we're also taking care of many other illnesses, car crashes, heart attacks, stroke, and we have sections of the hospital dedicated for those areas. So a very safe place to be. In fact, I feel this is one of the safest places to be, where we're taking care of both the pandemic and we're taking care of everyday health needs of our community. Our trend right now has leveled off for the time being. We have seen these numbers that I just showed you being relatively stable over the last few days, maybe the last week or so, and maybe coming down just slightly. Our intensive care units, we do have about 76 patients utilizing intensive care unit beds, which are shown on that dashboard, but we do have capacity to expand our intensive care unit. So we have what's called surge capacity. That is something that's not always built into health systems, but we have planned ahead. In fact, our planning for a pandemic started many years ago when, instead of coming up with bird flu plans and things like that and Ebola plans, we had what was called a highly infectious, newly emerging disease plan. And that way we could tailor it depending upon the situation. In this case, we have a respiratory virus, and our plan calls for how do we address that. So our overall capacity is there. We do track the number of ventilators that we have available, and we're doing fairly good. Now, many of you heard about supply issues, and yes, supply issues are still a concern. We have to watch this very carefully in our incident command, not only what we have on hand, but what we call the burn rate. How fast do we use these supplies? And it is a lot of variables, you know, how busy, how many patients are coming in. There's other diseases that require protective equipment. But the N95 masks are very important. We have to make sure we maintain those supplies along with hand sanitizer. You know, the testing media has been, at all times, been a challenge. The testing not only requires ingredients that you mix with the test sample that you take from the nose, but you need people, you need a lab, you need everything else to be in place for that. And we have to proceed carefully when it comes to testing, because that is the one critical measure that opens the door for treatment and to know, you know, who's contagious and where to go with that. And of course, the gowns, we go through those quite frequently in order to protect ourselves and to protect each other and to protect our patients. Next slide. Now, the treatments, we have protocols in place, and we have studied this throughout the world and the nation with the recommendations. And we make sure that we are really on top of this, and we share this with our providers. We have flow diagrams that take a person as soon as they walk in are recognized as having COVID. What are the most advanced treatments? Now, this is not a curable disease. This virus does not have a cure at this point, but there are treatments. When the infection occurs, when it first starts, there are medicines that interfere with what the virus wants to do. You know, it wants to come in, go into one of your cells, and it comes in with genetic material to tell your body what to do, which is to make millions of copies of it and release it, not only to infect other parts of your body, but to then come out of you and infect others. So that first drug, remdesivir, is a drug that interferes with the virus trying to make copies of itself. So that is one of the initial treatments we use. Now, we know that our bodies try to make proteins that attach itself to foreign objects, like a virus. And when that attachment occurs, when these antibodies attach themselves to a foreign object like a virus, it sends out signals that attract your immune system to attack wherever this thing may be. And so that's where this convalescent plasma comes in. People who have recovered from COVID can donate their plasma. They have antibodies in their plasma that they check on, and that being given, it's a very safe treatment. We would love to get more information on how effective it is, but it's safe, and we're currently using that. Now, we've also, and I'll mention this later, the virus is not the only problem. The other problem is sometimes the immune system attacks a little too aggressively and starts to clog up the air tubes. When the immune system is overly aggressive or not well regulated, you often want to try to tone down the immune response. And that can be done with a couple of medicines. I've given some examples here. One is dexamethasone, which is a very strong steroid, which pretty much slows down or turns off the immune system to some extent to help the body not overreact and clog up the air tubes. Tocilizumab is an actual antibody that specifically targets one part of your immune system to help slow it down, and we've seen some benefits in those medications. Now, it's not just all medicines. One thing that's not listed here is just the most obvious one is oxygen. We have to give oxygen a number of different ways. Sometimes you see the two little prongs that go underneath the nose. That can deliver oxygen and can sometimes make a person feel much better. And on occasion, when they're needing more oxygen, you can't just keep turning it up. Eventually, it just keeps coming out of the nose and not getting down into the lungs. You go to a face mask after that. And after that, you may have to go on a breathing machine, which is actually putting the oxygen down in the lungs. We did discover many years ago throughout the world, one treatment for severe lung disease is to actually lay face down. This is called proning. And when you lay face down, it helps the lungs move into a position which allow less pressure to get the oxygen in. So people on a breathing machine might be able to lay face down and receive better, more effective ventilation. We're actually doing this even before someone goes on a ventilator. If they meet certain criteria, we ask them to lie face down, and it improves their breathing through the parts of the day when they do that. Now, a ventilator, certainly we do things to avoid a ventilator because they do have to place a tube through the mouth past the vocal cords. So when you're on this, you cannot speak or eat, but it delivers concentrated oxygen, but sometimes too much oxygen can cause damage to the lungs. So there are advantages and disadvantages, and we know that opens up a pathway that sometimes you can catch an infection. So we watch our patients very carefully not to catch additional infection while on a ventilator. We raise the head of the bed if they're not in a prone position. We make sure their stomach acid is toned down, and so we're watching all that very carefully. Next slide. And I hope some of this will bring up some questions later. Now, we do take safety precautions. We have all of our team members and wearing masks in the hospital. We instituted this quite some time ago. Also, if we are caring for a patient and you're very close to an infectious patient, and we do this now for all of our patients, since you do not know who may be incubating the virus and not showing symptoms yet, everybody is wearing here at the hospital when we're with a patient close to them, an N95 mask along with eye protection. So we have that for all of our team members. Now, we've also limited visitors for a few reasons, is we're protecting our team. That's ones we don't want to bring infection into the hospital because someone may not know they're infectious. And we do this to protect our team and our patients. We also make sure that those who do come in are screened for fever and symptoms and for any other particular problems. Now, we do encourage that if you do come into our child emergency room, our children's emergency room, or our adult emergency room, call ahead if you think you have COVID, especially if you think you've been exposed and you're having some symptoms that need attention. Of course, call 911 if there's severe symptoms, but calling ahead can give you special instructions on how exactly to do this so that it's a smooth process, and we want to make sure everyone's protected. We know our emergency room, of course, is dealing with car crashes. We're a stroke center, a chest pain center. So we're always here doing those things. So our emergency department has both a respiratory side and a non-respiratory side. So it is safe to come to the emergency room to get all kinds of care. And so when it's an emergency, we have it designed so it flows well. And of course, it's been a very efficient emergency room. So we've been doing well with that. Of course, we put on our protective equipment to make sure we're protecting each other. And we do ask that patients wear masks. That really cuts down the spread of it when you're still determining what a person might have. Next slide. Now, we do have testing options. So our drive-through testing center, we've moved that into our garage area. Best to call ahead to set that up. That is mandatory to do that. And the turnaround time is about 3 days. We also have a new center in South Lakeland, our Medela Community Center, and providing testing there. And again, encourage that if you've been exposed, if you're having symptoms, take all the precautions not to spread it to anyone else, but that's where testing can occur. We also have a respiratory care center across the street from the hospital. Again, call ahead for that. And there you'll be provided with the ability to sort out if you're unsure, what are your respiratory symptoms? You may have a history of asthma, and could this be a flare-up, or is this COVID? Getting those questions answered is key also. And then, of course, when the symptoms are severe, getting into the emergency room to be cared for is a key thing also. And down the road, we'll be opening up other urgent care centers, so like at Pablo, our area on South Florida Avenue near the Pablo Street. And there we have specialists in the building, which is helpful. And that's another reason the emergency room is such a benefit to this community. Our emergency room has specialists handy. You often don't see that in a standalone emergency room. When you have an emergency room that is connected with a hospital, you're able to access all the expertise that's available from multiple specialties. Next slide. We have noticed, starting around in March and April, and especially in May, a decline in what we would normally see as things that can keep you healthy. And yes, we are seeing a fall off in preventative things, especially vaccinations, which is important. There's a cancer preventing vaccination. That's great to start with kids. The mammograms, colonoscopies, those things that prevent diseases down the road We can do these safely, and please, if you have questions and you're getting late for some of your annual checkups or physicals, call ahead to ask questions on how these are being done safely. Next slide. Okay. Certainly, my colleagues and I, we have seen it time and time again these last few months where a family member is brought into the emergency room and they say, you know, he had a little trouble talking and was having trouble holding things in his hand, and that was 5 days ago. Now he's really having trouble eating. Well, that's a stroke. You know, when you're having trouble talking and you can't move one side of your body, and after 3-4 days, really after just a few hours, that's too long. The stroke becomes permanent. That's an emergency. It's a 911 call. You're having a brain attack. And not to hold off coming and getting care. So we are seeing people should not hold off when they're having chest discomfort. For anyone, especially women, as heart disease is very common, and seeing what may not be chest pain but just really bad indigestion, that could be the signs of a heart attack. Certainly getting those things taken care of, because when you get to the emergency room, they may discover there could be other things that are to be taken care of. And we're a level 2 trauma center, so we have the specialists here available to care for a multitude of items. And also our chest pain center too. If an artery has to be opened up, that chest pain center is there and ready. So a couple of issues I want to point out about the virus. Yes, the infections for the most part are mild. It can be just like a common cold, and a few people have no symptoms at all. I will make note specifically, there are 2 types of people that when they get infected, there are the ones that will never get symptoms. If you did get a test, it might be positive, and they tend not to be that contagious. But I am worried about the person who does get infected and they are starting to have the virus come out, and they're going to get symptoms tonight or tomorrow. So they're going to get sick with fevers, chills, cough, trouble breathing. They are at the time feeling fine and out doing normal activities, which is something we're saying be very careful about. Wear a mask, because that virus is coming out in that example. It's coming out when they talk, when they cough, when they breathe, and the mask blocks that. So it's very important to have that handy. Also, on the next bullet, you know, being that if somebody cannot wear a mask or is not wearing a mask, staying that 6 feet away, because as I'll show later, the virus is on the back of your throat and down your back of your nose. And when it comes out, it's usually attached to mucus. You and I might have other names for that, but this mucus has weight to it. So when it does come out, it does fall with gravity and come down. Now, in the hospital, we do procedures that tend to bring it out even more, so it can float in the air a little more in the hospital, but generally out in the community, it tends to come out a few feet and then fall to the ground. Of course, people do put it on their hands. Next slide. Is that when it gets onto your hands, that's where you can spread it around. So if you are feeling sick, clearly stay home, but you may be spreading it when you don't know it, and you're putting it on your hands and you're putting it on doorknobs, and you can see where if you pick it up, you can actually get it on your fingers. Now, it cannot go through the skin. The way it gets into you, if you didn't breathe it in from somebody being too close to you, you can get it into you by putting your fingers in your nose or touching your eyes. Your eyes have a little tiny tunnel right up there near the nose that goes right to the back of your nose. And that's where your tears drain. And so if you rub your eyes with virus on it, you tend to get a problem of infection getting in that way. Next slide. We also know that, next slide. We also know that this hand washing is sounding so simple, but please make sure that kids and others that you're with, they're really washing the tips of their fingers. You make sure you get the germ inactivated by getting soap or hand sanitizer to your thumb and the tips of your fingers, not just the center of your palm or the back of your hand. Keep in mind, this virus has a very delicate covering to it called a membrane or an envelope. this envelope must be intact for it to cause infections. So we are very fortunate to know that all of our hand hygiene products and our cleaning disrupt or destroy this outer membrane, causing it to be no longer infectious. So it can be beaten down that way. Other viruses are much more hardy. Now, for people that get a mild case of COVID, usually staying at home, staying away from other people, practicing good hand hygiene can keep it under control. But if you're having trouble breathing, or you're having weakness on one side, or trouble speaking, we know that this virus causes other things. It can cause the blood to clot in a few people. And whenever blood clots, it can form what we call a blockage in, say, the vein down in your leg, and that could lead to swelling of the leg. The clot could break off and go to your lung. That's called an embolism. And then you can't get oxygen into the blood if there's a blood clot blocking it. So that's very serious. We can have clots form in the arteries leading to a leg. We remember this man who was a well-known actor on Broadway. He passed away recently, and he had to have his leg amputated because a clot formed there. And we've seen clots actually form going up to the brain, and a young person died because both carotid arteries clotted off. So we watch out for that very carefully in the hospital. We give medicines that reduce blood clotting, but it can be something that can present at home. It can actually present after you've recovered and see that. But we have seen the worst outcomes and the people becoming most seriously ill, especially with obesity. Obesity seems, and I've listed a few others, come with other diseases. So we've often seen people with diabetes or heart and lung disease have a worse outcome in addition to advanced age. They're having to learn more about why, but there is a suspicion that in each of these examples, the immune system is not well regulated. In a young person with no other health conditions, they get infected, their immune system turns on, attacks the virus, and starts cleaning up and knows when to turn off, and a recovery occurs. Unfortunately, when you're seeing these other illnesses I've listed here, like obesity, diabetes, and older age, their immune system is not well regulated. So there, the immune system may not know when to turn off, and it overreacts, and it comes pouring into the lungs, blocking the air tubes, and you can't get enough oxygen. And that's where those medicines like steroids and such can help. So think of some questions. I'll now turn it over to Patrick Phillips, who's going to discuss our community outreach.
Well, thank you, Dr. Haight, and thank you all for allowing us to be part of this. Just so we're clear, we will make sure, if we do not get to all the questions, we'll make sure to collect them and give some written responses back to the group. So that's an important part of this, and that's what I want to talk to you about today, really, is that, we have taken time. We've got a lot of folks that have basically created this from nothing, right? So there were no subject matter experts in January or February. No one really knew exactly. There was some framework, but we didn't know exactly what we were getting into. And we have created policies and procedures. We've created protocols, ways to help, kind of keep our employees safe, keep the environment safe for patients. And our role, and my role as over business development and strategy, kind of shifted a little bit, right? It's hard to kind of grow the business in today's world. So what we've been doing is sharing those lessons learned, what Dr. Haight has learned, what our CEO has pulled together, and our COO, and their collaboration with other hospitals, and we've put that into a business resource center. And so this is a pretty cool story of some of the success that we've had. This is John Bucklew, and he is the co-founder of the Joinery. They had 80 folks that they wanted to get tested real quick. We brought 4 folks on site, 2 registration folks, and 2 nurses, and we got everybody tested within like a 2-hour time period. And we're happy to continue to do those sort of things from a testing standpoint. If you go to the next slide, what you'll see from us is this is going to continue to evolve. Even just as recent as this week, probably that $25 per employee would probably go down to $0 given how rapidly we're expanding the offsite drive-through testing. So we now have 2 drive-through testing sites. What we can do if you are an employer and you want to get some your employees tested, we can set you up in a block time period to get that done, quickly as a group. That's probably for if you have 75 or less employees. If you have 75 or more, and you say, hey, I want y'all to do the testing on site, we can do that too. The $225 per employee is what we have up there as a starting point. The more employees that we test, the cheaper it gets. And again, these are base points. The testing mechanisms are constantly changing, and we know one of the biggest topics is, well, I want to get that result back immediately. And so there's a lot of different testing options. These are not immediate results. They take 3 to 5 days, and as the coronavirus has spread so much lately, it's taken even longer time sometimes with the send out labs. But we are working towards having an immediate platform that would be available for all to be able to use. So more to come. Again, I won't, for the sake of time, get into too much of this, but just want to make sure that what you're hearing is that whatever your need is, and so we've talked about helping out the joinery as a business. We have spent time with the 4 different colleges, from Florida Southern to Florida Poly to SEU and Polk State, talking to them about guidelines for reopening and how they want to go about it. Dr. Haight has been instrumental in that. Myself, some other team members, we're here to help. Churches had a really hard time trying to figure out, well, what can we do and how can we do it? So we put together an FAQ that basically just kind of explained, here's how you start to open the doors in a safe manner. Share that out, about 60 days ago to make sure that, we're trying to keep the reduction or the spread down for this thing. And so we're here as the evolution continues. We've got policies that we've developed. We've got webinars that you can use. We've got best practices, and Dr. Haight, myself, we have some other talented folks, that have helped create these documents. We're in the business of healthcare and in the business of helping folks kind of replicate and make it easier for them getting back to business in a safe manner. And so we've shared all those things out on our website. If you go to I think it's the last slide. But here's our website, and if you just go to mylrh.org, you can get to the business resources page. A lot of information on there that you can peruse and use for your local business. And feel free to email us. And I'm Patrick.Phillips at mylrh.org as well. We can get you answers for whatever challenges you may have. So with that, I just want to emphasize again, we've done, in addition to having this business resource center, having a plan to help support the community with this pandemic, we've still continued to get good outcomes. Dr. Haight mentioned the U.S. News and World Report, #1 hospital in Polk County. Mentioned number 15 in the state. We also just received from Newsweek that we have one of the best maternity hospitals in the country. 230 or so, I think, received this designation. There are only 6 in the state of Florida, and we were one of those. So in addition to trying to do things that will keep our community safe, we're also not stopping what we do in a regular occurrence, and that's providing great care for this community. We want to thank you for everything you've done to be a part of this journey for us. And we have a special quick little video that we just want to show to thank you and our community for everything that you've done for us. Thank you. Oh. You're going to play, Jennifer? Me.
To the nurses, doctors, and all the staff here at the hospital, we thank you for coming to work every single day and keeping us all safe.
The nurses, to the doctors, to the janitors, to the receptionists, thank you for all you do. Millennium donated about 500 meals last week. We hope you enjoy it. Thank you, thank you, thank you. We can never appreciate all the hard work you do.
Please stay healthy, stay safe, and we're all in this together.
That's awesome stuff, Dr. Haight. Patrick, thank you so much for the presentation. We got a million questions. We'll try to get to as many as we can. I will cut us off at about 5 till, just to be respectful of everyone's time. So, Amanda, are you going to be our question reader?
Yes, I am. Can everybody hear me okay?
Yes.
Okay. Yes, we've got about at least 20 questions that have already come through, so I'm going to try to group them together as best as I can, and I'm going to start with a collection of questions about antibodies. There's 3 questions here. The first is it true that antibodies fade over time so that an individual might potentially be able to get COVID-19 twice? Can somebody get an antibody test without a physician referral? If you think that you might have had COVID-19, should you go get an antibody test so that you could potentially become a plasma donor? And how would somebody go about either getting the antibody test or signing up to be a plasma donor? So there's the first set.
Okay, so on a few of those things, a lot of the answers maybe we don't know yet. We're still learning. Yes, some antibodies do decline over time, and they have been finding that so far. That, yeah, the antibodies do start to diminish, but we have not really connected that with whether that means you can get reinfected or not. It seems right now to be very rare to be reinfected. They've had problems in sorting this out because the test that you all see on the TV where they stick the swab in the nose, it's called a PCR test. It's very important for you to know that this test is only looking for a tiny, tiny piece of the virus, the little piece of the genetic material of the virus. It's not looking for the whole virus, the whole infectious virus. So you may still remain test positive for up to 3 months after your illness, and you are not contagious. But little pieces of the virus are still coming out enough to make the test positive. So that's made it very hard to conclude whether or not people are getting reinfected again. Antibody levels is going to be very individualized based upon your own immune system and based upon the infection that you had, a severe infection versus a mild infection. So we don't have the answers to that, but collecting antibodies, you do likely can get tested through contacting OneBlood, the people where you can donate plasma, which can be used to treat others. Usually a physician's order would be needed, or a nurse practitioner's order would be needed to get just an antibody test. But again, you're not going to be able at this point to draw a conclusion if your test is positive or negative. Some of these tests are not perfect, and the antibodies that they're finding, we don't know if they're the antibodies that come with an infection that may not be protected. So still a lot to learn, but please, if you have been infected that you know of, you can donate your plasma by contacting OneBlood and going through that process.
Okay, thank you. We have another set of questions that are all sort of census related, and I'll gather those together. How have your census numbers post-COVID compared to your census numbers pre-COVID? Where can the public go to get up-to-date census information about what's going on at LRH? And are all of the ICU beds in use right now COVID-related? If not, can the public determine how many are COVID-related and how many are not, as a way to gauge how severe the COVID problem is in the community?
So, and Patrick may have information on this, but also I could say that there's about 19% of our ICU beds are utilized for COVID at this point, because we have many other needs for intensive care unit beds after surgeries, after a heart attack, after things like that. The Agency for Healthcare Administration does hold a website that does provide some data, but it may not include the surge capacity that each and every hospital has available. So we do have ability to increase beyond our current numbers. Patrick, you may have a little more information on this.
Yeah, well, just a couple comments. I would say, as you ask over the past, like pre-COVID, and then now from a census standpoint, immediately when COVID started up with the elective surgeries being stopped, we saw a major decrease in the census that has since picked up. These kind of 4 months towards the end of summer have typically been lower census volume. So as the coronavirus has caused an increase, the 100 to 150 census kind of range of COVID-related patients, that has been handled by the typical decrease in census that you see during this time of the year. And the last comment I'd say is that, we are blessed with phenomenal leaders that are they're engineers by training, and I'm talking Elaine and Danielle, but they have thought this thing out 10 different ways, and they are prepared for any and all issues, and thinking through, well, what if this happens? What if it gets worse? I mean, you can rest assured we've got some really good contingency plans that are very well thought out by an exceptional group of leaders, and you combine that with the doctor power, behind that. We feel we're in a comfortable position to support this community.
I think a good set of follow-up questions to that is that we had a number of questions about how are you making sure that LRH employees, especially the floor nurses and the respiratory therapists, are getting rest and staying in good mental health with all of the media attention that keeps pointing to Florida as an epicenter. Are your nurses and respiratory therapy staff able to work normal shifts, or are they working overtime and extra hours? Are you fully staffed right now? There were a number of questions along those lines.
Yeah, Dr. you might want to jump in. We've got some nurse residents that are starting up. We've got some contracted staffing, but I would say overall, we constantly are working on, right. So this is a draining challenge for the front line. There's no better way to put it, right? And it is tough. This Monday morning, I was there, from 6:30 to 7:30, and we did a cheer squad. And so I'm cheering, with 10 other folks cheering just to show our support. And our talent division, with HR division, has done that and kind of set it up so that we're doing those type of things. We're recognizing teammates. We're recognizing the hard work. We're getting ready to have had 500 discharges of coronavirus, and making sure that folks know how appreciated they are. Can we ever do enough? Probably not. Can we ever do enough? Probably not. But we're certainly doing as much as we think we can. And there's no real good way to answer that. But we're trying our best, certainly, to support the most important teammates.
Okay.
The front line.
Yeah, I'll just add it is that supporting our nurses in training, getting our young people to be there for the next future needs that our community will have. And behind the scenes, the folks that are keeping the computers running, keeping the hospital clean, the food nutritious, it's just amazing. So I think the amount of energy that we get from our community is positive. I mean, it makes you feel happy to work here.
And I just say the more y'all help to support us, the better it goes. Like that thank you video was just all the great donations. We love, our teammates love that, and so keep thinking of us if you can, when you have the options. Send notes to those that you know that are working on the front line. They love to get those types of notes back to them.
And early on, back in January, I mean, as soon as someone come in to the hospital, recognizing them rapidly as someone who may have this disease, and then protecting our team members, protecting the visitors, and then having the correct isolation and working with the local health department to do the right thing started us off on the right foot. And so we've been very successful in preventing the spread of the disease when you see that risk there. So we've been very fortunate in that case.
Thank you. We have a number of questions, and I am sorry if I butchered the name, but I think I'm going to get close, about hydroxychloroquine, or however you say it, and why it was not on your list of treatments, and if it is available in the community for treatment.
Amanda, let's let this be the last question too, please.
Oh, okay.
Oh. So, well, I mean, that medication is used for other illnesses. It has not been shown to be effective for COVID-19, the SARS virus. It has some serious drawbacks to it when taking it. There are what we call observational studies. When somebody says, "Well, I gave it to 15 people," or then they all got better. Well, there's a lot going on there. A lot can be happening when people are getting better. For a variety of reasons, not necessarily a medication. And pretty much all the trials that were being designed to carefully look at how effective this drug is, the side effects, just didn't pan out. So yeah, the drug is available, but it's not something we recommend. It's something we do not put on our list of ones that we use. So hydroxychloroquine, those particular medicines, ivermectin, there's been a few others out there, which we have a team that goes and looks at each of the studies, and dozens of studies. And when something works in a test tube, it may show that the virus doesn't infect cells in a laboratory, but you're missing the liver, the stomach, the heart, kidneys that change these levels, and doesn't really give the big picture. When you use it in people, it has to be very carefully studied. Now, down the road, certainly open to studies that do come out that show new medications that may be working, including those two. And if they start to show that a double-blind, placebo-controlled, randomized study, which is a lot, but it basically means nothing's interfering with the interpretation or inserting any bias into it. And so far, we haven't seen those studies reassure us.
Fantastic. Thank you so much, Dr. Haight, Patrick, Jennifer. Thank you all for joining us today. This is very informative. I work for the city, and I've seen you guys up here talking for our city commission quite a bit too. So you're talking to a great group of business folks from around the area, and so it's a good ambassadors for the city. To think that you guys came from where you were in January to where we are today is a big deal. You're doing a fantastic job for this community, and we certainly appreciate you. So thank you so much. We're going to move through the rest of the program. Trey, do you mind taking over and thanking our guests and visiting Rotarians?
Sure. I'd like to thank our guests today, Nathan Hesseltine, Deborah Boynton, and Patrick Phillips.
All right. Thank you all for joining us. Not because there's doctors in the house, but our weekly quote: never lower your standards, always increase your effort. Unless, of course, you play golf just for the exercise. So our next meeting is going to be Heidi Waldron talking about Bonnet Springs Park and Rotary. Thank you all so much for joining us today. Again, thank you for our speakers. We thoroughly enjoyed having you here, and we look forward to our program next week. This meeting is adjourned. Thank you.